Now, this particular stretch of the coast is just the place to get a lungful of good fresh air. But other parts of the southeast aren't so lucky. Emma Thomas reports.
Is this the most mysterious road in Britain? It looks like a motorway, it sounds like a motorway. And a few miles back, signs will tell you you're on the M25. But apparently, this is a rural road. We're going to find out why this is and how it impacts on people's health. This area just south of the Thames in Kent is covered by Dartford Borough Council, and they have a serious problem. Dartford has one of the highest percentages of deaths linked to air pollution out of anywhere in the southeast. And over in Thurrock, it's a similar story. So what connects the two? The Dartford Crossing. The crossing is one of the busiest roads in the country, used 50 million times a year. Heavy traffic pumps out harmful fumes, and this stretch is a prime suspect as a source of air pollution. It's full to capacity most of the time, and congestion can quickly back up to affect local roads. Are you concerned for people living along that road in terms of their health?
Well, hugely concerned, to be perfectly frank. People's health is suffering quite badly. The main reason for it is because we have this huge chunk of motorway running through the middle of our town.
This busy road takes traffic from the M25 and onto the Dartford Crossing. In its shadow is a housing estate called Temple Hill. The residents living here are just a stone's throw away from that road. So are they being exposed to levels of air pollution that are harmful? Jim Sutton lives here. His late wife Judy had respiratory problems ever since she was a child.
She couldn't even walk up the road here. She was that bad.
And Jim thinks living so close to the road made her problems worse.
The air pollution around here certainly didn't help her. She used to say, "I wish we could move, Jim, I wish we could move." She said, "I'm not going to make old bones," and she was right.
But Jim couldn't afford to move, and his wife died. Experts have proved that people with respiratory problems like these are particularly at risk from air pollution, which can bring on early death. The government is required by the EU to abide by the limits on air pollution, and if they break them, they face fines. Nitrogen dioxide levels have been recorded by the council as being over the safe limits here every year for the past 15 years.
Now, this might come as a surprise to you, and it certainly did to us, but the government haven't been reporting the nitrogen dioxide levels here to the EU because they've classified it as a rural road.
How could this happen? Well, to begin with, this is genuinely not the M25. When they built it, they classed it as an A road, specifically the A282. Part of the reason they did this was to allow buses to use the crossing, which wouldn't be possible if it was a motorway. So even though it looks like a motorway, technically it's an A road. Dartford Borough Council pass on their own pollution measurements to the Department for the Environment, or DEFRA. But when that data came back in the form of an air quality plan, the council spotted there was something wrong.
As a direct consequence of the figures and data that was published in 2015, we discovered that the Tunnel Approach Road was classed as a rural road, and therefore the air monitoring figures that they had and that they were using was incorrect, because the road was classed as a rural road. It's quite shocking, really.
We've seen a letter from Therese Coffey, the Minister at the Department for the Environment responsible for air quality. In it, she says, the A282 in Dartford does not appear in the National Air Quality Plan for nitrogen dioxide because it was classified as rural and was therefore excluded from DEFRA's air quality modelling assessment. DFT, which is responsible for road classification, has confirmed that the rural classification was incorrect. The letter goes on to say the problem was fixed for data from 2015 onwards. So we spoke to the Department for Transport to find out how long they'd classified the Dartford Crossing as a rural road. But they told us this is a question for DEFRA. They said DEFRA designated that road as a rural road, not the DFT. So then we spoke to the Department for the Environment and we asked them for how many years has the A282 been excluded from their air quality modelling assessment. They replied, the A282 is correctly classified as an urban road and will be included in any future assessments reported to the EU. We are firmly committed to improving the UK's air quality and cutting harmful emissions. Keith Kelly at Dartford Borough Council is concerned that for years pollution data from Dartford was not getting through to the EU.
There hasn't even been the threat of fines where Dartford significantly exceeds the EU recommendations, as it has done for the past several years. We want help to get it resolved as soon as possible, the sooner the better, because it is blighting our residents' lives.
What do you think of that being classified as a rural road by the government and the government therefore not monitoring it?
Well, it's ridiculous. It's been one of the busiest roads in the bloody country, I would say.
Whether it's a motorway or a rural road, the people living next to it have a right to know what's in the air they breathe.
There is a lot of black stuff that you get on your shelves and things, and it's black, and I would like to know what's in it.
In order to solve the mystery of the black dust, we've decided to take some measurements of our own. We've got a specialist team to bring in a machine that will track the air pollution.
The machines will measure the level of PM10 and PM2.5. These are small particles of pollution that can penetrate deep into the lungs, and they've been linked with heart problems and lung disease. Professor Frank Kelly is an expert in air pollution. He'll be helping us make sense of the results. So how will these machines be picking up pollution then?
So what they do is they draw iodine in to the machine, and this one is measuring anything that's less than 10 microns in diameter. And to put that into context, if you take a human hair, that's 50 microns in diameter. So you get 5 particles across one of the human hair. So that means they're invisible, and that's why we need machines like this to measure the concentration.
So what are these small particles of pollution that we're measuring then?
From a health viewpoint, the larger particles are the ones which affect our airways, and the smaller particles are the ones that get further down into our deep lung. Increasingly, we realise that they have effects beyond the lung, so they're associated with heart disease, they're associated with stroke, they're associated with some of the neurodegenerative diseases such as dementia.
The machine will now be left for a month to gather data. It's time to catch up with Professor Kelly in his lab at King's College in London. He's about to deliver the results and tell us what's in that soot.
So what have we got here?
So this is the filter roll from the particle monitor, and as you can see, it's got a series of spots on it.
And what is in those spots? What are our residents breathing in?
The analysis of those spots indicate that there's diesel particulates, there is the black carbon which is coming from the exhaust from diesel cars, there is the particles coming from the abrasion of the road, and there's tyre wear particulates. This represents what people living in that area would be breathing in.
On several days during the month, the particle pollution levels exceeded the EU limits on what they consider is safe to breathe.
The European legal limit was broken on 3 days. And that was primarily because the pollution which the road is producing every day with the traffic on it was joined up with pollution that was coming over from the continent.
Was that harmful for the residents' health to be breathing this in at such a level?
It would affect some people if they had a respiratory or a cardiovascular condition. They may have felt more unwell in those particular days. But really, it wouldn't be sort of causing disease, because for that to happen, it requires exposure over many years, many decades.
So what do the residents who have lived here for many decades think about being exposed to harmful levels of pollution?
I feel sick about that, and I'm living here, and I could be ill any time, you know, and it frightens me as well.
I feel sorry for the little children that run around in this more so than myself.
Does it worry you that you're breathing this stuff in?
Well, it does now, yes.
The residents here thought they were living next to a motorway. It turns out that technically they were living next to a rural road. That error has now been fixed and the council's data is now being properly used to combat pollution. In the meantime, all the people living here want is clean air.